In a remarkable turnout, Bwama Health Center 3 on Lake Bunyonyi today witnessed an overwhelming response as approximately 500 patients sought medical care during the World Diabetes Day medical camp organized by the Global Livingston Institute in partnership with Kabale District, Rugarama Hospital, Bridge of Life, Awamu and Rushoroza Hospital.
The sugar is released little by little.
As part of the commemoration, residents near Lake Bunyonyi also actively participated in educational sessions promoting healthy living. Focused on cultivating balanced diets, these sessions empower individuals with the knowledge and skills to make nutritious food choices. Emphasizing the importance of diverse food groups, portion control, and mindful eating habits, the initiative aims to foster a community committed to overall well-being. The community at Bwama Health Center 3 stands united, embracing both preventative healthy care and nutritional education, marking a significant step towards a healthier and more informed Lake Bunyonyi community. Adela Amuthaile, a community health worker and a enrolled nurse at Bwama Health Center 3, shared insights into the successful outreach, saying that they registered about 500 patients who responded to the call of the outreach.
Today we were commemorating the World Diabetes Day as Bwama Health Center 3, but the main celebrations will be held on Friday at Rugarama Hospital playgrounds. But here, purposely we brought it here to benefit our people around the lake. They also feel like the celebrations of the World Diabetes Day. So we decided for our lake people around to bring them here. Because it might be difficult for them to go in town. Today we managed to screen over 500 clients with diabetes, then hypertension, and also checking for kidney function. So
Amuthaile emphasized the significance of extending professional medical services to the locals, highlighting that the facility, although providing hypertension and diabetes screening, introduced kidney disease screening.
Today we were doing hypertension and diabetes, and also screening for kidney functions. Major here we have been doing blood sugar monitoring and testing, then also hypertension screening. But for kidney function, we don't have those services here. So we are glad for GRI today, our people around the lake managed to access the services of kidney function tests.
Katie Chandra, the project director of Bridge of Life, reflected on the experience, stating that it was a great experience extending such a helping hand and medical services to the locals.
Really overwhelming, and also I think really telling when so many people show up. We were able to provide each person here with screening for chronic kidney disease, diabetes, hypertension, and more. Everybody that was identified at risk received a consultation with a healthcare provider, and then each and everybody that was screened today got a copy of their health results and health education about important things to stay healthy. I think one thing I learned is that a lot of people that showed up today, one, had never been screened for these diseases, and two, a lot of people were, their results showed they were in a high-risk category, but they didn't know they were in a high-risk category.
Chandra acknowledged the organization's broader impact, noting their work across several African countries and expressing gratitude for the unique experience gained in Uganda.
It's important people know their status. You can manage your hypertension, you can manage your diabetes without a lot of cost, right? It's much easier to manage these things than to manage chronic kidney disease or end-stage renal disease. So hopefully we identified that. And then we were giving just common health tips, right? Avoid a lot of salt. Drink water instead of risky drinks, right? Like Coca-Cola and soda. The importance of exercise and just getting that heart moving. And so I think it's just a lot of simple tips that we all have time to carve out in our day, or we can make a choice, right? We can choose something that's healthier versus something that isn't, or choose not to add extra salt to our food. These simple little things can make a big difference. You don't always always need medication to manage disease.
The residents also appreciated such an outreach, saying that the medical camp and educational sessions have made a significant difference in their community's well-being and knowing how their health status stands. This outreach has not only provided medical services to the residents in the Bunyonyi community, but has also empowered them with knowledge for a healthier future. A story by John Alamara, Norbert Nyamachi for Kigezi TV.